From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Secours clinical transformation kicks off the new year with astounding results from 2010. In the December issue of the Clinical Transformation newsletter just released, Secours Clinical Transformation highlights several success stories about clinical transformation. What is clinical transformation? Clinical transformation encompasses a comprehensive approach to the care continuum. Clinical transformation will improve quality, create holistic patient and resident-centered care experiences, and reduce healthcare costs by reducing waste, variation, and duplication. The Center for Clinical Excellence provides the framework for this initiative with the effective alignment of people, processes, and technology. Clinical transformation efforts led to various quality improvements last year, including reductions in hospital-acquired infections, patient falls, and hospital-acquired pressure ulcers. At the same time, engaged employees who work together to improve quality make clinical transformation possible. One example of working together is orthopedics. Orthopedics was highlighted as a multi-facility learning community. Why? Well, orthopedics was selected by the Clinical Collaborative as an area of focus largely because of the wide variation in outcomes. Outcomes like complications, length of stay, and cost, specifically for hip and knee patients. So, the Virginia and Kentucky markets have been working collaboratively to improve care for the hip and knee patient populations by identifying the causes of variation and sharing best practices. The team examined practices for emergency patients and elective surgical patients and concluded that several initiatives need to be in place. Accelerating time from the emergency department to the operating room, strengthening pre-op education, better and more consistent pain management, quicker ambulation post-op with an emphasis on fall prevention, and better, more consistent post-discharge care, including physical therapy and assistive devices to accelerate recovery and follow-up. Data collected from each program was used to develop targeted actions at each hospital to achieve improvement in global metrics like mortality, readmissions, and variable costs per case. To date, results indicate process improvements are working. For details including tables, charts, and the complete story, read the Clinical Transformation newsletter that was recently distributed, or go to IRIS and navigate to the Clinical Transformation community and look for the December 2010 newsletter. Secours Clinical Transformation, transforming the way we look at care delivery to improve how we can be good help to those in need. In other news, Dr. Sam Ross was recently appointed to the Federal Reserve Bank Board in Richmond. That's right, Chief Executive Officer of Secours Baltimore Health System in Maryland, Dr. Sam Ross has been appointed to a 3-year term as a director of the board of the Federal Reserve Bank of Richmond's Baltimore office. The boards of directors of the Richmond Fed's Baltimore and Charlotte branch offices each have 7 members. The Federal Reserve Bank of Richmond is one of 12 regional Federal Reserve banks located in major cities throughout the nation. They form a major part of the Federal Reserve System, the central banking system of the United States. Each regional Federal Reserve Bank is responsible for the regulation of the commercial banks within its own particular district. Just something we thought you might like to know. Please join us in congratulating Dr. Sam Ross for this prestigious appointment to the Federal Reserve Bank Board of Richmond's Baltimore office. Finally, Secours recently broke ground for a new $30 million facility in Chesterfield, Virginia. The aptly named St. Francis Watkins Center will be located less than 5 miles from Bon Secours St. Francis Medical Center in Midlothian, Virginia, and will bring new jobs into the area as well as increased availability of ambulatory services for the county's fast-growing population. The center will include the area's only freestanding emergency department as well as an imaging center and physician office space. According to Bon Secours, Virginia CEO Peter Bernard, Bon Secours has received tremendous support from Chesterfield County and its residents, and we are pleased to serve the community. To which Daniel A. Gecker, chairman of the Chesterfield Board of Supervisors, replied, "The economic impact of St. Francis Watkins Center will be significant for Chesterfield. Not only are we adding accessible, quality health care, but the number of jobs the project will generate is substantial." The project is split into 2 phases. Phase 1, expected to be completed by the end of 2011, will include a freestanding emergency department, a diagnostic imaging center, and a physician medical office building. Phase 2 plans are still underway, but once completed, the campus will consist of 2 buildings totaling 200,000 square feet of space. Please join us in congratulating Bon Secours, Virginia on this exciting growth opportunity. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.